Hello, and welcome to my capstone project presentation on the utilization of TeamSTEPPS interdisciplinary standardized communication to improve the quality and safety of maternal-child patient outcomes at a community hospital. My name is Christina Lafreniere. I'm a bachelor-prepared certified nurse in inpatient OB and electronic fetal monitoring. I started my career in 1995 with an associate's degree, advanced to my bachelor's degree in 2016, and am eager to graduate with my master's in nursing leadership and administration this December. It was important for me to choose a capstone that focused on quality and safety. I knew that I wanted to pursue my master's to increase opportunities for myself, particularly in quality and safety of patient care. As the abstract states, communication is a common contributor to medical errors. The implementation of TeamSTEPPS tools such as the CUS, I'm concerned, I'm uncomfortable, this is a safety issue, and the second challenge rule can lead to improved patient outcomes. This project involved 16 participants as they participated in learning modules, post-test, and evaluations. The components of the TeamSTEPPS project included the review of a scholarly article that included the consequences of miscommunication to medical errors, completion of a learning module that focused on the instruction and teaching of the CUS standardized tool and the 2-challenge rule. After the completion of the learning module, participants were asked to complete a 7-question test to determine their understanding of the tools discussed. After the learning module, the participants were invited to a 1-hour interactive presentation to discuss TeamSTEPPS implementation, cost-benefit analysis, and to review interest in moving forward with the implementation of TeamSTEPPS. After the completion of the entire project, participants were asked to complete a post-test and an evaluation. The environment of the project took place in a maternal newborn unit of a 265-bed rural community hospital. The unit assists with 1,200 births annually. The participant objectives were that the participants were able to identify at least one expected benefit of the implementation of TeamSTEPPS, the completion of the learning module test with a passing score of 80% or higher, and the learner was able to state 2 barriers that they have experienced to professional communication that they've experienced in the last 12 months. So why was this important? Why should we speak up? It was important for the participants to understand that 4,000 surgical errors occur in the United States annually, that another 40,000 to 80,000 patients experience death or injury from diagnostic error, that verbal communication between healthcare members is impactful to patient outcomes, and that many times the error is a process issue. And that's why it was so important for the participants to be an interdisciplinary model. It is important to understand a glance at the problem, specifically for the maternal population, that the United States has one of the highest maternal morbidity and mortality rates, that 700 annual deaths contribute to preventable errors, and there has been a significant increase of maternal mortality over the last 20 years from 1987 to 2016. It was important for the participants of this project be from all interdisciplinary fields. Each one has an influential role to play as a stakeholder. The nurses directly involved in the patient care, to the pharmacists who are dispensing crucial medication, the dosing, the medication, the orders, are all play a key role in providing safe patient care. There's case managers that really impact the safe discharge process, particularly on a maternal newborn unit, making sure that there's a safe plan of care. The chief nursing officer, director of quality, nurse managers, they all play a pivotal role in making sure that they support the implementation of TeamSTEPPS and the concept of TeamSTEPPS. Because in order for TeamSTEPPS to be successful, it really needs to be a top-down approach. And making sure that we include the patients and the families as influential stakeholders to this project. There are countless medical errors that may have been prevented if the healthcare professional listened to the patient or the family member. And it is important for us to always include them as an influential stakeholder. TeamSTEPPS itself is rooted in patient quality and safety. It is supported by 30 years of research, developed by the Department of Defense for high-stress industries. Communication, teamwork, and developing a culture of safety are all at the core of the TeamSTEPPS training system. There's pieces to the TeamSTEPPS training system which all participants for the presentation were educated on. So you have the Master Trainer, which is a 2-day course able to teach the TeamSTEPPS concepts after completion. Train the Trainer is a 4-hour course for direct patient caregivers. But the Train the Participant is a 2-hour course for non-clinical staff, because again, every interdisciplinary approach that can take place must take place for a successful TeamSTEPPS organization. That means that the CNO, the CEO, the CMO, along with all EVS, dietary workers, security workers, parking guards, valet guards, everybody that is an employee of the organization must understand, agree to, and participate in the TeamSTEPPS concepts. The TeamSTEPPS tools for improved outcome are listed below. There's an abundance of tools, but I knew for this project I had to focus on a couple tools to maximize my success of understanding and implementation. And for my project, I chose CUS and the 2-challenge rule. CUS is I'm concerned, I'm uncomfortable, and this is a safety issue. And that is used from one healthcare professional to another to say, you need to stop and listen. What I am saying, I am concerned about, I'm uncomfortable, and this is a safety issue. And when TeamSTEPPS is fully implemented, that person that is hearing you say CUS stops in their tracks, listens, and hears what you're trying to say. The 2-challenge rule is similar to CUS, but it's when you bring a dosing error, a surgical error, when you see any healthcare worker going to do a practice that is unsafe, you are expected to stop them and challenge them, and not stop there. You challenge them again a second time to make sure that they hear your safety concerns. Again, making sure that that culture of safety, the person that is saying this and the person that's receiving this has a common understanding of why we speak like this, and the purpose is for patient safety. So why isn't this easy? The participants of my project were given these examples of common errors that occur for organizational change. We allow for complacency. We get tired. We just do it all the same way all the time. Nothing's going to change. We did see this a little bit in my organization with COVID. We had a surge in March, and we were very diligent about our policies and procedures. And now, September, October, we could feel ourselves getting a little complacent. And then recently, we understood how that could impact error for us. And we made sure that we weren't being complacent. And that is very important for organizational change. Failing to create a powerful guiding coalition. Again, I've talked about this at my presentation, how important it is for all be on the same goal, have the same vision. allowing obstacles to block change. There's lots of talk about we don't have time for that, or it's always worked this way when we've done that, or it's not going to happen again, or that person doesn't work here anymore. And neglecting to anchor change firmly. And in a couple slides down, I'll talk about what's a very common occurrence and sequence of change when I speak of the Lewin change model. Other contributing factors to medical errors is poor handoff, ineffective communication, not following protocols, workload fluctuations, interruptions, multitasking, the halo effect, and hierarchy. Many of these I would assume that the audience that I'm speaking to through my PowerPoint, we have all experienced this. We have all had days where we could tell that we were ineffectively communicating. We had one patient assignment go to another patient assignment, or as the charge nurse, we gave one novice nurse maybe 3 assignments in 2 hours. And we do that because we have nothing else that we can do. We're trying to cover all the patients, but really to be able to step back and say, okay, I am participating in these contributing factors to medical error, and be able to look at that differently. Hierarchy is a very important concept of healthcare. I think as nursing students, as soon as we go into healthcare, we understand the impact of hierarchy. You know your role, and nursing, not questioning the physician, or we've talked about that housekeeper maybe not feeling comfortable going to a nurse with a concern. And hierarchies can be very detrimental. Everyone in a TeamSTEPPS model has the same respect, and for patient safety has the same, we're all on an even playing field. The difficulty with hierarchy is when you practice in a hierarchy, many times you can become fatigued, intimidated. All those things that we associate with bullying can really be in an organization that has a very delineated hierarchy. But what's challenging about hierarchy is there are healthy hierarchies that must happen. If we look at a code situation, somebody needs to be the leader, somebody needs to be ordering the medication, somebody needs to take that lead, and they need to be at the top of that hierarchy when you're in a code. So it can be a very gray area, but practicing in hierarchies can be very dangerous. So Lewin's 3 stage change process, practical steps. This is the theory that my project was founded on. Lewin's change model. There's a point of unfreezing when the change happens, and then refreezing. So it's important when you are doing the unfreezing stage is that you're identifying those unhealthy communication tools that we're using now. Those intimidation, the practicing with hierarchies, not feeling like you can speak up, not feeling that you can report a near miss or a medical error as of being afraid for the consequences, and then giving those tools. So changing and unfreezing that bad behavior, you're going to start seeing change. We're going to communicate often. We're going to make sure that we're empowering that action and involving all interdisciplinary teams in the involvement of that process change. Refreezing is when it's a very slippery slope. We can find ourselves getting kind of falling off of that change because we haven't anchored the changes into our culture. So this is where TeamSTEPPS needs to be part of it's like breathing in an organization. And how we do that is we can celebrate small successes, and we can acknowledge when people are doing everything the right way with TeamSTEPPS. Also, consistently reevaluating where you are. This is another slide that talks about Lewin's change theory. You have this unfreezing process. Again, we're starting to break down those walls and individuals' resistance of change. And then as you're moving forward, that stage involves a process. People are starting to feel differently. They're starting to behave differently. They start seeing results. And from there, that's when we need to continue to celebrate success and continue to reevaluate. The leadership role that I played in this capstone project is that the organization was very important to me. I knew that during this time of easy, unsettling times of COVID, that my participants had very little time. I could capture them if I was organized, impactful, and laid out exactly what they needed to do, and also get them excited about the results of TeamSTEPPS. And that was my role as the leader. So the project results, I'm happy to say that 14 out of the 16 participants that were invited completed the module test, and all participants had a passing score of greater than 80%. The post-test completed by 12 out of the 14 participants at the conclusion of my presentation. All participants successfully identified 2 barriers to effective communication: dangers of hierarchies, the background of TeamSTEPPS, and the difference between SBAR and Pass the Baton in transfer of informational tools. This allowed me to say that my objectives of the project was to start somewhere with the understanding of TeamSTEPPS and the implementation of TeamSTEPPS, how it could positively impact our patients. I then gave an evaluation. The questions below, the presentation content is applicable to my daily practice. I have a greater understanding of TeamSTEPPS. I'm willing to participate in training, and I have self-improvement opportunities in my own communication score. So this was a very positive evaluation. Most people answered definitely for these questions. If I were to say the most impactful question would be that they've had identified some self-improvement opportunities for their own communication, hoping that they now go out and walk the walk of TeamSTEPPS, and that my project continues to bleed to the practice of other individuals in the organization to improve patient outcomes. The evaluation also had some room for comments, and some of the comments are listed below. I can't wait to start TeamSTEPPS. I love the CUS concept. I'm encouraged to see how this can impact patient outcomes. Hierarchies need to be broken down, and I think this is a great program presented clearly and concisely. The conclusion, the evidence speaks for itself, that we are urged as a public health concern that patients are experiencing injury and, God forbid, deaths over medical errors. The number one contributing factor to medical errors is team communication and miscommunication. The implementation of the TeamSTEPPS training program has been recognized as a result-provoking training system that includes educating and training every staff member to reduce medical errors. The results were positive, and I anticipate future support from my organization. After the presentation of TeamSTEPPS, I also proposed a detailed cost-benefit analysis and was invited to sit with the senior leadership for continued implementation, continued training and classes for TeamSTEPPS. Thank you for joining me and for my project. I wish you all the best of luck as we move forward as graduate nurses. Thank you.